When it comes to fertility care, you want to make sure you choose someone you can trust. And RMA of Texas is here to help with top-notch physicians. And today, Dr. Francisco Arredondo is here to tell us about everything they have to offer, including some very new treatments that are really paving the way when it comes to infertility. Thank you for being here.
Thank you, Kimberly.
You were just educating me on what you do, and this is, I want to call it new technology. Can I call it new technology?
Yes, it's breakthrough technology, yes.
Okay, tell us about it, what you're holding, and how this is helping so many people.
Yeah, this is called INVOcell, and basically instead of using a laboratory, we can use this, and the future mother will become basically our incubator because she has the right temperature, the right pH, the right CO2, and basically makes it much more affordable. So we increase the people that can afford the dream of having a family. That is basically what it is very interesting about it, and it's very natural. It's more organic because it is inside the patient.
Woman.
Yes,
it is inside her. Now, traditional IVF is very expensive, and it's been around a very long time. This, however, has only been around a year.
Yes,
it's
FDA approved, so this is not experimental.
Right.
This FDA approved. We happen to be the center that has done more in the country, and basically this little device is the process is half the cost of IVF. Half
the cost.
Yes, and we have completed close to 100 cases, and while it doesn't replace in vitro fertilization, it basically increases the people that can have a family. So the pregnancy rate is not as great as in vitro, but it's almost there, and it's much better than any other treatment.
And you were saying it's organic.
Yes.
Yes, very organic.
Because the woman keeps it inside her during the process of fertilization. So
as opposed to outside.
Yeah, so she's in control. She's in control. She knows, and she's playing a role in the process. So that makes it much more interesting for them.
Well, who is a candidate for this procedure? Like, when should someone make an appointment with you?
Sure. Well, everybody that is unable to have a kid should make an appointment. But the people that are ideal for this is people less than 38 years of age, and people that have the tubes are not working. Or people that have a little bit of a male factor, because obviously 30% of the times it is the male that's responsible. Right. So there is a big gamut of possibilities of patients that can use it.
So this really is changing people's lives, because up until this point, I mean, traditional IVF is very expensive. I know you have a very high success rate, but a lot of people, they would just give up on having a family because they thought, well, we could never afford it.
That is correct, and that's why it's so really amazing, and we feel so empowered because we're helping people that before had come to us and couldn't afford it, and now they are able to do it. So that's really, really helpful.
This is great news for people who just dream of expanding their families and having a baby. And if this is something you are interested in, give them a call, excuse me, at RMA of Texas. They are at 19296 Stone Oak Parkway, number 200. You can always call 210-FERTILE or 210-337-8453 or go to rmatx.com. Dr. Arredondo, thank you.
Thank you, Kimberly.
Wonderful things
a pleasure.
You're doing. Nice to see you again. And stick around, guys.